video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jaclyn from the Lost Labia Chronicles, where I talk about all things lichen sclerosus. So, if you have LS and you are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and please keep on watching. And if you have a friend, family member, or loved one with LS and you want to learn more about the condition so that you can better support them in their journey, then please subscribe to this channel and keep on watching as well. So today I am here and I'm going to be joined by the incredible Magalie, and we are going to talk about the launch of the VLS Toolkit, which I am so excited is finally launching. I think this really has the potential to create a lot of change for the better for the LS community. So without further ado, I'm going to bring on Magalie and we are going to talk all about this toolkit. All right, so welcome Magalie to my channel. It's an honor to have you here, and I'm really excited to talk about the VLS Toolkit. But before we go into that, I'd love if you could kind of introduce yourself a little bit. What brought you to the sexual health and research space, number one, and then kind of tell us a little bit about Sex Ed Plus and what you do there.
Okay, so yeah, my name is Magalie. I go by she, her pronouns. I speak French, as you may notice, so pardon my accent. And I come from social science, so I have been like working on inequality issue, oppressions, privilege, like activism in queer movement, anti-oppressive movement. And this kind of led me to work in nonprofit dedicated to women health and women rights, and after like more broadly sexual health and sexual rights. So I came from social science to arrive into sexual health. Like I do not come from the medical field. So my view on it is always really human rights based and like defending people who are marginalized by like whichever identity or experiences they have, and like the idea of having like extremely inclusive care and like considering all bodies, all identities, all experiences. So yeah, that's where I come from.
I love that. And Sex Ed Plus, tell us a little bit about that. What do you do there? What's the kind of overall mission and vision?
Yeah, so sex ed actually started from academic research, strangely. People will always be like, oh, you're an artist. I'm like, no, not at all. Like, I do social research. And we did with some colleagues at Université du Québec at Montreal, like a research about like what the youth thought about the sexuality education they received.
Mm.
And it was at this moment where the government of Quebec wanted to bring back mandatory sexuality education in school, formalized, but they did it on themselves, like without consulting the people who were doing it. And we were like, in one hand, it's really good, and like kudos to that. On the other hand, if you do sexuality education wrong, you can really damage people. And so we were like trying to be like, how can we be like supportive of people who are going to do that, but in the same time pointing fingers at what is done wrong. So we were like, the best way is to go collect the kids' experiences and show people how they can be negatively impacted if you are not inclusive, if you leave them on the side road, basically by not talking about them. And so we did this research, we arrived with like 10 or 12 points about like what is important to change to do good sexuality education. And as with every academic research, it's like, yeah, it was put on a shelf and yeah, let's do
Yep.
something else. But one of these points was we will not change the way we do sex ed as long as we do not change the material that we use to do sex ed. Because what we traditionally use is reproductive organs, so very binary, very based on reproduction, and it's leaving on the side like a lot of experiences and realities because most time we don't have sex for making babies. And it was at the same moment that Odile Filliot, the French researcher, released the 3D printed clitoris. And so it was this kind of conjuncture of things where we have the first 3D clitoris, and like it totally changes the way we do sex ed because we have an object that mediates knowledge and transfer and questions and everything.
Mhm.
And I was coming, like we were coming with this research being like, oh, like we need different tools for sexuality education. It was like, oh, there is something going on. And I started
Mhm.
looking around and I was like, oh, is there someone doing this? And actually there was not. There were like very little initiative
Mhm.
in some places in the world, but that were not supported and they couldn't even come to fruition because people got exhausted, like trying to carry them. And this is where I came in. I was like, I had a bit of an unemployment period, and the clitoris always broke. Like I was using it between my legs
Mhm.
like many times a day. And
Yeah.
because it is plastic made, it was
Right.
breaking. So I was like, oh, maybe I can tinker and try to make like a soft one,
Yeah.
which I did in silicone. Like someone showed me how to do it, managed to do it, contacted Odile in France that I didn't know. But I was like, hey, here you go. Like I've tried to improve your clitoris, and when I come to Paris, like I should come and visit you and give you one exemplary, which
Mhm.
I did. She then brought me to the hospital where she had a meeting with some people working on genital mutilation. And these people were like, oh, that would be interesting. Like we have some needs
Mhm.
about like, because most of the time they will do intervention with people who don't speak the same language, don't have the
Right.
same culture. And it is very difficult to talk about genital anatomies because most people do not have the terms, the knowledge, and the experience. So it kind of snowballed from there. It's like I come from the field, like so I speak with people and like people will be, hey, we have a need, and I will be like, I don't promise anything, but if I can help you,
Mhm.
let's do it. And so it literally started like this. And when I got to the end of my unemployment, someone mentioned me, oh, you've got this program for new startup where if you qualify, they will give you 1 year minimum wage so you can slowly build your thing, which I did. And we are 6, 7 years later. And for the anecdote, like I'm still in my pajama in my basement, like last week, I won like the award for entrepreneur, like femme d'affaires du Québec, which is like,
Amazing.
it was like the most ridiculous thing. But, but yeah, I put on a glamorous dress for once. And it was good actually to see this project recognized outside of the field of practice.
Yes, yes, 100%. Oh, well, I love all of that. And I'm so excited and so grateful for what you do. Now, I actually met Magaly at a conference this year. That's how we kind of connected. We were at the Society for Sex Therapy and Research. And I had gone in early, checked in, put my stuff at my desk, and I walked out. And I always like to come early to check out the different booths. And I walked out, and it was impossible to see anything other than Magaly's booth because you were immediately just taken in by this colorful, vibrant display of genitalia. And me being me, I was like, that's where I need to be. I need to go check this out. I don't know what this is, but I'm going over to find out. And there's a couple other people. And so at first I just started, looking at the different models. Of course, me being me, I gravitated towards the vulvas. There were also penises and different, things, but I was like vulva because that's where my brain goes. And I was looking at all the different vulvas and the diversity, right? Like there was some cisgender, there was some transgender, there were some who had undergone surgery. Such a nice diversity. And when Magaly was free, when some people left, I remember saying like, "Do you have any vulvas with lichen sclerosus?" Magaly was like, "No, no, I don't." And I was like,
And I didn't even know what lichen sclerosus was.
Right, right. So I gave my little, 2 minute, this is what LS is in a nutshell. And, I would love to see representation because we don't really have models of people with lichen sclerosus. And I would love to kind of add to the growing diversity that you already have cultivated. And, like Magaly was saying before, you come to her with an idea. Can I help you? Yes, let's do it. We were like, okay, we're going to work together. We're going to make this happen. And we didn't really know initially what we were going to do. We were just like, okay, here's my contact. Here's my contact. We'll figure it out. We'll get some LS vulvas out there. And so what we basically did, we set up this workshop at Magaly's place. And so we had people with vulvar lichen sclerosis come and join. I started by giving, an hour of education, and then I opened the floor for questions, for sharing resources, for sharing stories. And it was just kind of like a community building moment. And then people that attended the workshop also had the opportunity to have their vulvas cast so that we could actually build out a kit that involved vulvas with vulvar lichen sclerosus. So I think there was like a nice handful of us, myself included. I challenge you to guess which one I am. But I was one of them. And so we got that done, and we are finally at the point where we are ready to launch the Vulvar Lichen Sclerosus Toolkit. So Magalie, why don't you tell us a little bit about the toolkit, what's in it, who's it for, all those details.
Yeah, so all of the models that I create are actually molded on people. They are cast on human bodies. So the idea is to have to create a database of what exists, and it's to better train physicians because doctors are not well trained about, if you go to a simulation center, you will notice that the genital part of the mannequins, they are more like Barbie and Ken than representation of real humans. And so the idea was to actually show the diversity of genitals and have everyone included, because everybody should be known, researched, cared for, and a good quality of care goes with good training of the physician, and also good intervention when you are if you're a sexologist, if you're a doctor, if you're a nurse. It's how do you talk about something when people don't have the words? So the idea of having a 3D thingy really helps for that. And so during the workshop, we had 5 volunteers who wanted to willingly cast their body. And the way that it is done, it's I'm not any kind of artist who is gonna go into people's legs and take an imprint of their genitals. Is not at all the way that I think it. It's more seen as an empowerment thing where people will do it themselves. We'll have the possibility to live with the cast reproduction of their body, and it's part of owning our bodies and making peace with them, and they are what they are, they look what they look like, their history is what it is, but at the end of the day, it's the only one we have. So let's learn how to care, respect, and love them the way they are. And so these 5 people at different, they all had lichen sclerosis, but at different stages. Some of them were diagnosed for more than 10 years. Some of them, it was extremely new. And it was really comforting for them because we don't have someone like Jaclyn in Quebec. And in the French-speaking Quebec, so for them it was really good, we're translator, and finding a community, getting together with other women who have had the same experience. It was really comforting for them to find a community. And I would just show you what they look like. It's not going to be the best with the light. But for example, this one is a person, I will say woman because everyone identified as a cis woman. So this one is a woman who has given birth. And actually, when she gave birth, one of her labia tore up. And it has been like that ever since because it never properly healed because the skin was so damaged. This one, we've got up, here we go. So it's someone who was actually completely, was got no internal labia. And so we have had the condition for quite a while. You can also, because the model, Jaclyn, so you can intervene. These 2 ones, the light, the neon colors are not really good for.
There we go. That's good. We can see that.
This one and this one, please focus. Are of people who do have the condition, but it has been very recently diagnosed, and they do not have a lot of architectural change into their body. And this one is from someone who is in a remission and has been for quite some time. So Here we go. So those are the five vulva that we got. And as usual, when I create a kit, there is always a there is always a document like that, which is available in French and English, and in which I explain a bit what it is, and like every model share what they want to share about their body and their relationship with it. And what is fantastic and slash completely sad is that there is so little documentation and support material for people with living with this condition that when Jaclyn last weekend actually released the information that the kit was ready, like we had a lot of people from across
Mhm.
the world being like, I'm volunteering to translate it in Spanish, in Portuguese, and because like people do not have anything to support their work
Mhm.
and their activities. And so I actually have someone from Lisbon who is currently translating for free as a
Right.
volunteer. And because I'm going to Lisbon in December, like I may actually bring some kids over
Mm.
there. But it shows like the need, the absolute need to create support for people to know what it's about, like to know that this disease exists so that when they have symptoms, they can insist with their doctors that no, it is not, that they are stressed and it is not thrush.
Mhm.
And and so because if people knew like from the public that this condition exists, maybe they will manage to get more attention from the doctors who most of the time will not know. And we have people waiting for 10, 15 years
Mhm.
because getting a diagnosis when they could have been in remission like 15
Mhm.
years earlier. And it's like so much pain, so much suffering, so much impact on your sexual health, your self-esteem, your relationship to your body, just because we don't know and we have never heard. And like I work in sexual health, it's been 20 years and I didn't know what vulvar lichen sclerosus
Mhm.
was before I met you. So it must be really invisible because I'm literally my nose
Right.
in genital for 20 years.
Yes, and that's the thing, I find that there is such a deficit in sexual health research and in medicine. So many clinicians and educators have never heard of this, and if they do, their knowledge is so small, basically. They don't know much. And so I was so excited because I think this is a great tool for both clinicians and educators, right? And so there's so many ways that this can be used. So one is to educate, future med students, current medical providers. Here's, what these genitals look like. And why it's important is there is actually, we only have five, but there's so much diversity in those five. And that's what I think was important because sometimes providers have this idea that all vulvas with LS look the same. So they think, okay, to have LS, there has to be like no inner labia and a fused
Mhm.
clitoris. But what you can see here, clearly, some people still have inner labia. Not everybody has the architectural changes, and there's such variety. So it really forces clinicians to think a little bit more critically when they're looking at vulvas to not just make these black and white kind of calls like, oh, no labia, therefore LS, or labia, therefore not LS. It's much more complex than that. So exposing them to a diversity of here's what, vulvas look like with lichen sclerosus is one thing. And then why I love that Magaly has those little brochures, if you will, that write up a description about each vulva, a little bit of the history, a little bit of the relationship that the person has to their genitals. Why I think that's also so important is at the same time that humanizes these models.
Yeah.
So they're not just a clinical tool. And that's, a part for me, as a patient advocate, that's so important that we don't just have these clinical tools. So people are like, okay, like anatomy, anatomy, anatomy. I want clinicians to realize there's a story behind this. There's a history. There's a human being with feelings behind this. And to read all of those stories will start to expose clinicians to, the different lived experiences that, their patients may be experiencing. And so I find that's really important too. And then for clinicians who are actively practicing, right, gynecologists, dermatologists, vulvar specialists, like you were pointing out, when we talk about our anatomy, it's very abstract and confusing for most people. So some folks don't know the proper anatomical terms. So if you're just spitting out all of these big words, they're not understanding what parts you're referring to. And even if you do know the parts, sometimes it's still so abstract that it's hard to really understand what they're trying to say. So what, one of the things that I was, envisioning and hoping is that we're going to have clinicians that have the toolkit in their office. And so they can show their patients, here, take your medication. I want you to apply it here. See how there's no labia, it's been resorbed. That's okay. I want you to apply it here anyway. Or, explaining what's happening on the model to make it less abstract and to make it more real for the patient in the office. So I see so many ways in which these can be used as, validating and education tools. And so I'm just so excited. And also as a patient, I just find this so validating to see, right? You'll see online, they have like vulvar diversity libraries and stuff like that. And I remember early when I was diagnosed, I would look at so many vulvas. Like my search was just vulvas. And I couldn't find a single one that looked like me. And I remember that feeling, and despite all of that diversity, I remember feeling like so alien, like,
Yeah.
how can there be so much diversity and yet I don't see a single person like me? And so it's also validating as a patient to see this toolkit launch, because now we are being represented and we are given a voice. And so again, thank you so much, Magaly, for doing all this work and for collaborating with me and for caring about this community enough to say, yep, this has to change. So let's talk a little bit like more of like the kind of housekeeping details. What's the cost? How do people purchase? And shipping. So shipping is a big question, right? Remember, we put that Instagram post and people were like, we want it in Finland, we want it in Sweden, we want it in Argentina. And we were all like, whoa, okay. So clearly people want to know where it can ship. So again, how do we buy it? How much is it? How does it ship out?
Okay, so for shipping, it's very simple. I ship everywhere Canada Post is shipping, which is basically everywhere.
Yeah.
Except that right now, Canada Post is on a strike. And I do respect strongly the right of people to strike. So nothing will be sent until the strike is resolved.
Right.
Because Canada Post, like they did big strike and it brought to us a lot of things like parental leaves and stuff like that. And so we need to support them. But it means that right now I'm not sending anything. But if you have people passing through Montreal and you want like to have stuff during the strike, like please come to the workshop and you can come and pick your thing. For the price, it's always the same with sex ed. I do a sliding scale. So it depends who you are. Like a non-profit will pay less than university or hospital will pay. So the price for the kit is going to be in between 230 and 300 Canadian dollars. I know it's kind of expensive, but it's silicone, it's handmade. I do it in my basement, but I work on accessibility down the line. Like I'm trying to 3D scan all of the model to make them available for free on a genital database that is going to be online and accessible. But for that, I need to find $200,000. So if you have that lying around, because the goal of the project is to become free. Like I do not want to become
Yeah.
big. I do not want to start manufacturing in a houseware. It's not that. It's really to be free because it shouldn't be reserved for people who have the money to pay. And how do you access it? It's extremely simple. You go to the website, which is positivesexed.org, and you request a quote. Because I always vouch for people who are buying the models, because my models are not like creation of myself. They are reproduction of real people bodies. And we have a consent agreement with my models that their body are going to be used only in a setup that is educational or medical. So I have no judgment toward like the type of other use that could happen, but it's just not going to happen with the model I produce because it's not the agreement with the models. So I will always vouch that you are like working or advocating in a setting that is like respectful. You do not need to have a diploma. I mean,
Yeah.
Jaclyn could use them
Right.
and doesn't have a diploma in whatever. Yeah, you have a lot of diploma, but not in this
But
field.
but I'm not a medical doctor per se, and I don't have a clinic.
Yeah, but it is okay. You can still access it if you are like
Mhm.
a patient advocate, if you are working in a Planned Parenthood, in a non-profit, if you're a sexologist, like all of this use, like I define professional quite broadly.
Mhm.
And yeah, I think that's it for housekeeping. And so when you buy the kit, like you've got the five vulvas coming together. They will come in a little bag. I will add a little clitoris button and sticker. And yeah, and everything, it's like you really support something like all the money that I make is like reinvested in creating new models and like down the line in creating the genital database. So everything is made locally by hand by me. Like I have no employee. I am my
Mhm.
own
Yep.
Swiss knife. And yeah, or house elf. You can call me an house elf. That is cool.
I love it.
And yeah, so I'm trying to be as ethical as possible in the production of the material because it's I mean if you talk about sexual justice and reproductive health, it's
Yeah.
like it's across the board. It's as much supporting the strike of workers that it is of like not having your produce manufacturers in factory where workers' rights are not respected and women and children are put at risk. So for me, it's like it's the whole shebang. Like you
Hmm.
can't like pick and choose. I mean,
Yeah.
you have sometimes because like we're all humans and have two ends, but trying the best.
Hmm. So would you recommend, even like the strike is ongoing, would you recommend people request a quote anyways, just to kind of start that process and get the information that they need so that when the strike is done and Canada Post resumes delivery, you can kind of move that forward?
Yeah, that would be the best because I'm gonna
Yeah,
leave
that's what
for
I was
Europe
thinking.
in mid-December and I'm only coming back in mid-January.
Hmm.
So to meet colleagues and see family and things. So you can definitely, like, I'm still keeping up with the orders. I am packing them. I am
Right,
stamping them. It's
exactly.
just they are staying in the basement.
Yeah,
And once the striking is done, I will go and post them. So you
perfect.
can definitely like talk to me. And it's good because as I produce them as the requests
Right.
come, like it's better if you say it in advance.
Mhm. Yeah, perfect. Okay, so I have a question for you, but also a question for anybody watching. So the question is, obviously, one of our goals is to get these kits into hospitals, universities, CEGEPs, clinics. How, do you have any thoughts as to how we can kind of reach these areas and let them know about the kits? Because one of the questions we were getting on Instagram was, I want my doctor's office to get this. How do I get them to buy it? Right. And so I'm asking you, but I'm also asking the audience. So if you have any recommendations on how Magalie and I can, approach different institutions, how we can get this into more places, please let us know. Magalie and I are both very outgoing and on it. You give us a suggestion, we will get it done. So any suggestions, please throw them in the comments or email us. But do you have any initial thoughts on that, Magalie?
Yeah, like the only way I found to actually reach the people was going to conferences where you've got the professional working on the matter directly.
Right.
Because like you can still send the leaflets to like the clinic or something, but you never know
Mm-hmm.
who is going to open it. And if I have the money, I'm gonna try to go to the Ishwish conference in Atlanta. Let's go together. It
Yes,
would be
yes,
fun.
that's what I'm hoping. Yeah.
And I think it's the best to actually meet the people who are doing the work. And
Hmm.
it's the way it has worked for sex ed. Like I didn't go top down. I
Right.
went like go to conference where you have the practitioners and they will go to their institution and be like, I need this. If
Amazing.
they need it, they will request it. Because
Okay.
single individuals, like even if you pick your phone and you're calling like the
Hmm.
obstetric and gynecology board of Canada and be like, hey, I've just manufactured vulvas. It's like no one is taking you seriously while it
Hmm.
is so serious and important. But
Right. Absolutely.
yeah,
Yeah, I agree with that for sure. Conferences is a big way to go. So if anybody is watching and attends sexual health, vulvovaginal, genital pelvic, anything like that, feel free to kind of let as you're networking, let folks know. I know that, I'm going to have a toolkit too. And so any conferences that I attend, that toolkit is always going to come with me, and it's always going to come up in conversation, because you cannot meet me in person and not hear about LS, which means you're now also going to hear about the LS toolkit. I think also, as an individual patient, if you're in the office, with your gynecologist or dermatologist, and you have a good relationship with them, you may let them know, hey, there's this VLS toolkit. Here's the website, just let them know a little bit about it. And, if they have questions, who they can reach out to, word of mouth in that sense definitely can't hurt. You never know. Share this video, like this video, so that it really gets out there, so that more healthcare providers will watch this video and then maybe be enticed to do it. Of course, translation is a big thing. We want this translated as much as possible. So, I have a free ebook on lichen sclerosus. Right now it's in English only, but that's going to be in French very soon. So we're excited for that to be available. But if anyone wants to support this initiative and help us with any kind of translating, proofreading, anything like that, we really do. Even in North America, there's such deficits in knowledge with lichen sclerosus, but when we zoom out more globally, there's even bigger deficits. And so I think that, the more information we can get out there in more languages, the better. So again, let us know if there's any translating or proofreading or anything you can do to kind of help us out in this initiative. That would be great. And yep. Okay. And just to kind of close us out, Magalie, for people that want to follow you, follow your work, where can people find you? How can people connect with you?
Okay, so the best is the website, so positivesexed.org. And after, I am on LinkedIn, Instagram, and Facebook. And but it's a hit and miss, because I have been so strongly shadow banned for the
Yeah.
last few years that even if I post, like, no one is seeing it. So please go and give some love. Like, one day I would love to get out of the closet, but Meta is keeping me in the closet. But LinkedIn has just kicked me out once, so it could be a good place to go and get me. But like, if you really want to be in touch, like, if you go to the website, you can subscribe to the newsletter. And because I pay, it's like probably the only one that is not going to be cut. And I promise
Exactly.
you, I'm not posting anything sexy or reprehensible. I just make genitals, and I don't even put picture of them, and I just get banned because I mention genitals. So it's maybe not safe for every workplace, but there is really nothing that is gross about what I do.
Right. Amazing. Okay. So I'm going to put all of Magalie's links, website, stuff like that in the description box below, so you can check that out. My information will be there as well. So thank you again so much, Magalie, for joining me, for having this conversation, and again, for fighting for the VLS community, for making this toolkit, and for caring about this community. I really appreciate
It's a real pleasure. Thank you,
it.
Jaclyn.
Bye. Take care.